My name is Kirk Hamilton, your host of the Staying Healthy Today show. This is a show where we bring you key experts in the fields of nutrition, prevention, integrative, and lifestyle medicine. Today, I wanted to go over something very simple, but it's, I think, quite important. And that's how I work up a patient from a nutritional, functional, and lifestyle medicine perspective, and how I do it over 43 years, because it keeps evolving. But the first thing I do is when someone either contacts the office or is in an office visit, the first thing I do is I ask them, what do they want to get rid of? What complaints do you want to get rid of? I don't necessarily want a disease label. People like to do that because I look at your health as spokes on a wheel, and we're tightening spokes to make the wheel run better. So I get maybe 3 to 5 complaints from the patient. And then what I do is I go through each decade of life. And sometimes, if they're older, I'll go 2 decades of life and I'll ask them how their health was. Was there anything that sticks out? And what I'm looking for as I go through each decade of life is generally an insult to their immune system or an insult to their gut. For example, a young child has chronic ear infections, lots of antibiotics. That would be one flag that something's happening to your gut. Another might be chronic antibiotics for acne when you were a teenager, or frequent sinus infections or bladder infections. And the reason that I'm doing that is I usually or many times see in people who have long term illnesses and autoimmune diseases, something happened to their gut along the way. Chronic antibiotics with a very highly processed food diet, lots of sugar, and you're going to create imbalances in the microbiome. I'm a believer in fungus. It's been there a long time. I've treated it for a while, but it's not the only thing. But you alter the gut flora. And remember, we have 37 trillion bacteria in our gut, and we have 30 trillion bacteria in our body. So whatever happens in the gut can set the stage for lifelong problems with your immune system, with your health. So I do that through each decade of life, picking out the things that I think are important. And then I always do a diet history. And people say, well, I'm eating, this perfect diet. So what you eat for breakfast, what you eat for lunch, what you eat for dinner. I ask you what your snacks are. I ask you how much alcohol you consume. And I ask you about sugar consumption. Those are the biggies. From there, exercise. Do you exercise? I can just tell you, after doing this in my own life in 43 years, those who exercise do much better in everything. If you don't move, you're really hurting yourself in trying to get well. I do an environmental history. Uh, so, for example, I'll ask about your bedroom, your house, dust, pets, mold. Mold's a big one. I've done some training in mold treatment under the Shoemaker protocol, gone to their conferences. That's a difficult one because people have to deal with their home and they don't really want to do that. And it's expensive to test a home, and there's controversies on which tests are best. But I always do that as far as a history. Lyme disease, since I don't treat it, I've tried in the past, but it doesn't resonate with me. We send, if I think there's a Lyme person, we'll send them to other people, or I will send them to other people. So then I also ask, social history. What are the big stressors in your life? So from there, after I go through all that, I'm looking at different spokes on the wheel that we might test for or treat. So I do a fair amount of testing. I do a lot of blood testing for vitamins and minerals and blood sugar control, both fasting insulin and A1C. Fasting insulin to me is probably one of the most important tests that there is because it gives you an idea of insulin sensitivity and where your insulin goes. Uh, Generally speaking, and your weight goes, there go a lot of problems. So I will go through the testing. We'll do hormones if it's appropriate. We'll do the basic. Normally, when a patient comes in, they say, "Well, I've had a bunch of blood testing," and basically, it's a CBC, a comprehensive metabolic profile, and that's fine for some severe illnesses, but it's not going to tell you anything virtually about nutrition. And in the vitamins we do, definitely vitamin D will be done every time. I'm doing a lot more vitamin B1 lately, zinc, RBC magnesium versus serum magnesium, CoQ10, uh, and essential fatty acids, omega-3 fatty acids, and again, as I mentioned, hormones, if it's appropriate. I don't present as a hormone clinic, though I've been treating for 25 years, because I think hormones are part of the whole. They're one of the spokes on the wheel. So if someone comes here and just says, I just want hormones, generally they're not, um, they might not be happy here because I just don't do hormones. I try and look at the whole thing. So I don't put myself out as that, though I treat hormones all the time. I like people to work at their health first and then layer hormones on top versus just take hormones and expect them to do the work. So when after I take that history, if it's appropriate, I'll do a physical. If not, we'll wait and we'll do the laboratory testing. And the laboratory testing usually takes 2 to 4 weeks to get back. In the type of laboratory testing we do, we send it to the basic labs like LabCorp and Quest Labs, but then we also send some alternative labs for some other testing. So I usually put an appointment out, results visit 4 weeks after that. And in that interim, what I like to see people do is to go on some form of elimination diet. So the base would be I take everybody off all wheat products, all dairy products. People are eating a lot of eggs right now. If they're eating them 4 or 5 times a week, I'll take them off those. Obviously, sugar, alcohol, and caffeine, but I don't want to be a hypocrite. I try and get people off caffeine for a while. I shoot for a month, but they can learn something in 2 weeks. Actually, they can learn something in a week. If people really are sensitive to foods and they eat whole foods, but minus dairy, wheat products, eggs, sugar, and alcohol and caffeine, many people are going to have dramatic improvements in their health. And I mean, most people will have dramatic improvements in their health. Sometimes it's hard to do, but I can't tell you how many serious things I've seen clear up with dairy product elimination. I do wheat not because it's gluten. I do wheat because wheat is attached to all the processed confectionery foods. So, for example, if you eat a croissant, yeah, you're getting refined wheat flour, but you're also getting a bad oil. You're getting no fiber, probably getting some sugar. So, those kind of foods, if you just say wheat, that eliminates them. And many people will do very, very well. I don't say get off the good grains, where it be quinoa or brown rice right away. Um, I usually allow people to do that. So I have a handout I give that. Then people come back and we go over how they did. Did they improve? Did they even try the program? Okay. Did they improve? And then we make adjustments according to the blood work. Uh, so that's then we go out again for 2 to 4 weeks and see if they continue to improve. In that interim, we might, if somebody's really fatigued or worn out, or they have some serious issues, we might start intravenous vitamin C infusions with multivitamin mineral cocktails. Sometimes add glutathione or piggyback glutathione. We'll do H2O2 as well. So I'm a big fan of IV therapy, and I'm a big fan of including B1, B12, and folic acid in a B vitamin injection. The B1 especially. Most people don't do that. They get B12 or they get B12 folic. B1 is very important in energy metabolism. It stings a little bit, but it can dramatically improve people's energy and well-being and nerve function. So that's like the first month that I try to do. If I think that there's an infection, let's say someone had heavy antibiotic use, lots of sugar consumption, I might just do an antifungal trial of 2 weeks to see if they improve. And for me, that's a systemic antifungal like fluconazole or itraconazole. Then I'll use nystatin tablets sometimes, nystatin powder sometimes, and a probiotic. But I want to knock down what I perceive as possibly a fungal load, and the therapeutic trial is really the best way. Stool exams don't really clarify that. Um, and then when they come back, then they come back and we adjust. And I keep asking about those top 4 or 5 complaints. I'm a big fan, before I forget, of fasting, the fasting mimicking diet. Use Prolon all the time. I've used it myself personally. I used it during my cancer treatment. I use it still to today. And I think it's a great tool for one, you get off food you're sensitive to. because you're eating a dairy wheat free and egg free diet and sugar free diet. So it's kind of like for 5 days, I get people on what I want to see them on, see if they have any changes. It's going to stimulate autophagy, cellular cleanup. It's going to reduce your inflammation. It's going to reduce your blood sugar, lipids. And generally, the reason I like it, the Prolon, is because I know what people are on if they do it. And then I can see if there's any improvement in their symptoms when they get off the foods they normally eat. And and then with reintroduction, so let's say you don't notice anything when you go on some kind of modified fast, then I say pay attention to when you reintroduce foods. For example, if you reintroduce foods and it's nothing happened on the prolong, the fasting mimicking diet, but all of a sudden you can't get your ring off because your fingers are a little swollen or your joints are a little stiff. I see that all the time. Those kind of, I see pain go down. So I really like the fasting mimicking diet. There's tons of scientific research on it. It's very well done, and it's something everybody can do. And the staff here does it during work, so it's something that anybody can do. So I deem it as a test, a treatment. It's your food for 5 days. It's not just another diet. And those are the basic ways I get people started, and then we branch off from there. If they're not improving or something like that, we might dig into the mold issue more. And I like to give hormones after people have worked at their health a little bit, not right at the beginning. But I use hormones, especially in males over 60. I don't like giving hormones per se in younger men than 60. I mean, I've done it, but I want them to work on their health first, and you don't want to suppress, someone's own production. So what I say to males is they don't really realize is that probably go on hormones for life, if you do this, because most people go on hormones, it'll suppress their own production. If they're producing any, and so that's something for life, and that's something to think about. So that's the way I get started with patients, and I spend a lot of time with patients. It takes time to talk to patients and then recheck. And one of the most important things is we all get busy, but you want to make sure someone does what they say they've done, so you can relate the symptoms on when they come back for another office visit. For example, if you just say how you doing and they say I'm terrible, but you don't really quiz them on did they do exactly what you said they were going that you agreed to do, because there's an expectation there and there's an experience that they will improve. And so it's very important to document what people have done. So that's just a general approach. If someone sees me, I think I've got it all or most of it. And I'll talk to you soon, and you have a wonderful, wonderful day.